welcome everyone. I'm Maria Marshall. I am the director of the North Central Regional Center for Rural Development. And it's my pleasure that we are doing this webinar with our sister center of the Southern Rural Development Center, also regional, even though they have regional in the name. I am very happy that we're able to collaborate with our sister centers to bring you this really interesting webinar today. And I know there's a lot, we have a full house, or if I could say that, today. So we're still letting a lot of people in. For that, because there's quite a few people in our webinar, I'll ask that you put questions in the chat, and we will answer the questions at the end of the presentation. I'll keep monitoring the chat to make sure that if you have a question at the beginning of the webinar, we don't lose track of that. And with that, let me remind you of our next webinar. I don't know if you can advance the slide for me. Our next webinar is March 25th from 2 to 3, and it'll be the North Central Region Outdoor Tourism Listening Session. So we look forward to that webinar on March to get your insights on outdoor tourism. And I believe our sister center did one either this month or the month past on a listening session. So again, we're hand in hand with our sister centers. With that, let me introduce John Green. He is the director of the Southern Rural Development Center and a professor in the Department of Agricultural Economics at Mississippi State. And he is going to go ahead and introduce his colleagues. Go along.
All right, thank you. Good afternoon, everyone, and thanks for joining us. And I'll say that we're trying to keep up with who we're communicating with through this webinar and through our dissemination of this work. And so if you would like to put your name and institution in the chat, please feel free to do that so that the presenters know who they're speaking with. With that, I'll say that, again, as Maria mentioned, I'm John Green with the Southern Rural Development Center. And for this session, my co-presenters and I will provide an overview of the Rural Population Research Network's stakeholder listening sessions project that we've been conducting over the past year or so. Paige Kelly, Sridhar Upendram, Christina Brandt, and Katherine Curtis will be presenting as well during today's webinar. Sorry. So over the next 3 slides, you'll see different members of this team. We have a large team that includes more people than that will be presenting today, but Paige, who you'll hear from, and Christina, both from Penn State, Sridhar from the University of Tennessee. We also have Danielle Rubart from Penn State, myself, and Katherine Curtis, who will also be presenting, and Katherine's from the University of Wisconsin. And then rounding out our team, we have Jason DeKoff from Tennessee State, Eleanor Green, also from Mississippi State, and Gloria Mangione from Penn State. In terms of disciplines, we have several disciplines represented that includes rural sociology and demography, economics, and even agronomy. So to provide some background to the development of this project, it's helpful to note that the Regional Rural Development Centers conducted a survey of rural development practitioners and virtual listening sessions to inform investments in capacity building, given the impacts of COVID-19 and the associated economic crisis of the time. There were 4 general regional sessions and 4 national listening sessions. The latter focused on the topics of rural innovation and entrepreneurship, workforce development, community leadership and governance, and digital access. Among the key findings, the one that influenced what brings us together here today was the need for greater attention and information about rural populations' characteristics and the changes occurring across rural places and populations. This helped inform the more recent and focused listening sessions through our Rural Population Research Network. Starting with activities associated with the September 2023 meeting of the RPRN, we prepared an in-person listening session that was held in Nashville, Tennessee, hosted by Tennessee State University Extension. Working with contacts there and through the University of Tennessee Extension, we recruited rural researchers, especially and practitioners engaged in the realms of community and economic development, federal and state agencies, and extension. We followed this with a series of 4 virtual listening sessions conducted in February 2024, just a year ago now. We specifically recruited for cooperative extension professionals through our team members, state, regional, and national networks. The face-to-face session in Nashville had 38 participants, including practitioners and researchers. The 4 virtual listening sessions had 89 unique participants, primarily extension professionals, and some participated in more than one of the thematic sessions. The listening sessions consisted of small group discussions with both a designated facilitator and note taker. Substantive discussion themes included agriculture and food systems, community and economic development, environment and natural resources, and health, healthcare, and disability services. For the virtual listening sessions, these topics were addressed separately, one each week. The common questions that you see listed here were explored across small group discussions centered on how the respective theme relates to rural population change and what issues the participant states and communities face that require more research attention. Our process for data analysis included multiple rounds of thematic coding. The team initially read through the notes and transcripts to generate an inductive list of themes emerging across sessions. Then, using that coding list, participant statements were first analyzed by one researcher and then double-checked by a second researcher. Any discrepancies were discussed with a third team member until we reached consensus. The themes and their associated patterns were then used to frame the presentation of our results. In the report produced from this research and in our presentation today, the themes are organized by listening session topic. We present key patterns, but also recognize there's no single story that can fully capture what is rural America. There have been common experiences, but also substantial variations. From the many ways that we can think about the causes and consequences of population change, today we'll use a key lens: similarities and divergencies by population growth and decline. These emerged as key themes from the listening sessions themselves, rather than imposed by us from the start. I want to end my remarks by noting that the final report from this project was peer-reviewed and revised based on that feedback. We presented the work at the RPRN annual meeting that was held in Kansas City, Missouri this past fall. And in addition to our network members, we had representation from the U.S. Department of Agriculture's Economic Research Service and the National Institute of Food and Agriculture, as well as from the Federal Reserve Bank. Now I'll pass it on to my colleague, Paige.
Thanks. So getting into what we found through the listening sessions, we first asked stakeholders to consider how rural population change impacts and is impacted by agriculture and food systems. And they raised critical issues facing their communities. And here we're going to enumerate on 5 of those themes that emerge. So first was the shortage of fresh food, both in declining and growing rural places. So in areas experiencing population decline, access to fresh food is increasingly becoming difficult. The withdrawal of major grocery stores exacerbates this issue, leaving residents with limited options. This challenge is further compounded by the lack of transportation, forcing residents to travel longer distances to find fresh food, often at higher prices. So as one participant shared, food prices we live in, I don't say it's kind of like a quasi food desert, but a lot of people do. Their affordable shopping have to travel half an hour, 40 minutes to a grocery store. And the grocery stores that we do have, I mean, those prices are 50 to 60% higher than, say, going to an Aldi or Walmart. Conversely, in rural areas experiencing population growth and diversification, particularly driven by minority ethnic groups, there is a challenge of accessing culturally appropriate food. So grocery stores in these areas often do not stock foods that are meaningful to these communities, leading to a sense of living in a food desert. So as one stakeholder noted, where we live, we have a large population of Hmong, a big Hmong community here. So there's a large population here and it's in the rural areas. It's harder to go to grocery stores. And even if there is the food, it's not geared towards minority ethnic population. So it's harder to access. Next slide. A second theme that emerged was related to the rising cost of land, which often comes at the expense of medium and small scale farmers. So high land price was raised as one of the most significant barriers to small scale farmers' financial viability because it makes it difficult for them to purchase land, turn a profit, or sustain their operations without relying on off-farm income. Farm land consolidation, or the expansion of larger farming operations into areas with declining and aging farming populations, was also cited as a major barrier for new farmers' entry into the agricultural industry. A third key finding was additional pressure on farmland coming from the competition between farming and non-farming land use, such as industrial, infrastructural, and residential development, including new facilities like distribution centers, especially in regions experiencing population growth. So this competition over land drives up the land prices and taxes, further straining the financial viability of small farms. And then finally, the intensification of farming operations such as dairy and crop expansions pose significant environmental threats, particularly by increasing competition for clean water resources. Next slide. Thank you. Okay, so then next we asked participants, so this was our second focus group topic, to consider how rural population change impacts and is impacted by community and economic development. And from these sessions, 4 overlapping themes emerged. So first was limited economic opportunities and skilled workforce. Here, participants highlighted that rural economic opportunities were hampered by a deficit of employers to meet job needs, the offshoring or relocation of jobs to other parts of the country, and farm consolidation. Specifically, they noted that the loss of major employers in a rural community can spark a feedback cycle of declining opportunities as supporting businesses close, such as restaurants, grocery stores, health services, etc. And we can see this in the first quote, which they stated, I feel like it's kind of cyclical. So I'll say there's no reliable labor, but there's not jobs. It's kind of a weird thing. So more ag jobs would support the rural businesses. So I have several towns that just really don't have a place to eat in town, and you can't buy your groceries where you live. Rather, you have to end up driving 3 hours. Corresponding to a lack of economic opportunities was also a lack of skilled workers to fill potential jobs. So participants discussed that even when employers considered locating businesses within communities, there can be a lack of qualified workers to meet these businesses' needs. These further fueled economic decline as skilled workers may migrate out when economic opportunities leave. As one participant explained, what we see is if there's not a good pool of employees there, either the workers stay or they don't come at all. And so that is an issue, especially for the communities that lose an employer. And we've had that happen with a number of them. And it's hard to get something back to replace it. Next slide. A second theme was regarding limited community services. Here, participants emphasized that a lack of community services, such as reliable and affordable broadband, banks, public transportation, childcare, healthcare services, etc., acted as a barrier to recruiting both new employees and workers. And then finally, insufficient housing stock was cited as a major barrier to rural development. Participants noted that a deficit of housing units and poor quality of existing housing acts as a barrier to recruiting workers and employers. Finally, among rural communities experiencing population growth, issues of housing affordability are a pressing issue, as long-term residents may be priced out as newcomers have moved in, or as housing and tourism-based communities are bought up to be used as short-term rental properties.
One of the most discussed environmental issues was increased pollution. Stakeholders were concerned more about deteriorating air and water quality in areas of population growth, due to increased industrial development and tourism-related activities. With new industrial growth, there's a threat to clean water resources. And although tourism generates higher economic activity, it's also a source of more traffic and air pollution, thereby, more concerns of littering and dumping in natural areas. Another concern was declining agricultural areas and a shift from smaller family farms to more consolidated large corporate farms, leading to potential contaminated water sources and poor air quality. There's also a potential deterrent for new residents to move into these areas. In areas of population decline, lots of resources led to a smaller tax base, supporting infrastructure that's crumbling and needs significant investments to repair and rehabilitate more to meet the federal and state standards. And you see the quotes in there, pollution amount, population growth. They've got a lot of industries coming in. We've talked about bringing in jobs, but there's also lots of changes with respect to construction and housing. Of course, they're building a lot of roads, but it's also increasing traffic, affecting air quality issues and water quality. In terms of population decline, we're seeing an increased base of resources being pulled out of rural areas. So truly crumbling infrastructure for a lot of these rural, mostly poverty-stricken areas. People don't have sewage and they don't have access to safe water and electricity around the year. So those are more challenging issues. Next slide, please. So in terms of industrial growth, tourism, and corporate farms, they require large quantities of fresh water and produce even greater quantities of wastewater that strain local resources, infrastructure, and increasing the air and water pollution concerns. Maintaining natural resources like trails, lakes amid increased use is difficult, especially in rural areas, because they lack the capacity and the resources. Much needed infrastructure upgrades and a diminished tax base affects rural areas experiencing a population decline. Renewable energy receive particular attention among stakeholders, specifically wind and solar energy. Development in wind and solar farms can take farmland, use up natural resources, and compact soil. Although profitable for some of the landowners, there are also growing concerns among local residents, making them less desirable. Use of rural land to develop energy that supports urban areas have increased rural-urban tensions and increased conflict. Many stakeholders are concerned with the impact of climate change on environmental and natural resources. As population in urban areas move to rural areas, competition for land has driven up prices, heightening the demands for natural resources, infrastructure, and a greater risk for pollution. Preparing rural areas for climate change is crucial to mitigating impacts. Next slide.
All right, so I'm going to cover the findings from the last stakeholder listening session. And so that was the one that was on healthcare, and disability services. And this was one of our most well-attended listening sessions. We had 6 focus groups that were going on at the same time in this listening session. And so like Paige and Sridhar did, I'm going to summarize what our main themes were that arose in the listening session. So the most discussed issue by far across all the groups was these growing gaps in healthcare services. So there was this universal sentiment that people spoke about, that there was a growing and really urgent need for more and more diverse types of healthcare services across the rural areas they were speaking about. So there was a special concern about access to specialty care, so meaning like access to doctors with specialties in fields like say cardiology or neurology. There was also particular concern about access to mental health care, both for like very basic preventative purposes like counseling and for more intensive care like inpatient treatment. There was concern for care for older adults and for folks with disabilities. And this was especially an issue, folks told us, because of the trends that we've been seeing about aging in place and increased rates of disabilities in rural places. And then there was also a stated concern about access to maternity care for pregnant and postpartum mothers and having close access to obstetricians for monitoring. So this concern for a lack of services was universal, but it did have a slightly different flavor in those declining versus growing communities, as Sridhar and Paige were talking about. So in declining areas in particular, people told us about healthcare facility closures. So a big thing of what was driving the gaps that people have seen are closures. People were especially concerned about recent hospital closures. We talked at length about the impact that this can have on mortality in the face of emergencies. And we also talked about how these closures could create spirals of decline. So like healthcare facilities were closing due to being, you know, economically unviable because of not having enough patients to serve. But then that could actually cause remaining people who have health issues and people who require more constant care to then have to leave their communities as well to be closer to services. So this, you know, was connecting to some of that spiral of decline in population. So the closure of these facilities, right, was like due to population decline and then fed back in to further it. In growing areas, by contrast, right, we still heard about these gaps in healthcare services, but people told us that they were caused by the healthcare industry largely just being unable to keep up with that growth. So newcomers, you know, might be moving into those communities. Sometimes it's permanent, sometimes seasonal, but that increased demand on healthcare providers. So these stakeholders in more growing areas told us that, you know, the current supply of providers just wasn't keeping up with this increased demand, and they were seeing, you know, longer wait lists for care. Stakeholders also told us that both of these types of areas were struggling with talent acquisition and retention. So they were struggling to find providers to fill gaps. And so that made the gaps particularly intractable. Again, it was a slightly different flavor of the mechanism behind this in the two types of areas. So stakeholders that were serving declining areas told us that the communities that they served lacked amenities that were needed to attract new providers or even to keep existing providers. So like say even if a healthcare company wanted to situate a new facility in a declining rural area, people said that they're finding it would be difficult to find providers willing to move there to serve in that facility. Because of a lot of the reasons that Paige mentioned earlier, right? Because of the lack of desirable housing or the lack of jobs for providers' spouses, the lack of childcare, the lack of community amenities that people want, or something else like that. Conversely, in the growing areas, providers might be excited to move to these communities, but what we heard was that local property was just becoming too expensive, even for providers to afford to move. And this might be less of a concern for those types of providers that are in the highest paying types of positions, but for lower paid healthcare providers, it could be cost prohibitive. People expressed a particular concern about one type of provider. There was a lot of talk about concerns of recruiting home health aides. And again, this was a particular concern because of that growing aging population that people were seeing in these areas. But these jobs also tend to have lower salaries, so that was making that recruitment piece extra difficult. So we chose these two quotes on the slide to exemplify this challenge, this gaps in healthcare services challenge. And the interesting thing about these two quotes that I like to point out is that they're both actually speaking about the same state. So both of these stakeholders work in the same state, but one was speaking more about declining communities in the state while others spoke about growing. So from the person speaking about a declining community, the declining communities they served, they said there's not that many hospitals and there's even fewer mental health providers. So that's forcing some people to sometimes move away from the places that they love to go to, those few places where they can access the care that they need. And then it pulls away resources from those rural areas as a result. So conversely, the practitioner who was working in the growing areas of that state told us, you know, we're seeing the population increases and the healthcare is decreasing and there's not a good balance. There's more people, there's more needs. We're seeing a lot of very bad things in terms of both physical and mental health in our rural areas, and we can't keep up. All right, you can go to the next slide, John. Okay, so this first big challenge that arose was about not having services available locally. But interestingly enough, the next big issue we heard about was the underutilization of services that do actually remain in rural places. So what that means is that even when healthcare is available locally, it just might not be used by people who live there. So this was again framed as an issue in both growing and declining communities. So something similar about these two different types of places. So participants told us that often they saw some of the residents in the communities they served lacking trust in their local care options, feeling that the local options they had were inferior to the options that were available in nearby urban settings. And some reasons for this lack of trust included concerns about high rates of provider turnover, concerns that their local providers were young, maybe less experienced, and worries that their local facilities didn't have the most up-to-date equipment or maybe sufficient resources. And people told us that, residents would take on this additional burden to travel to further facilities, believing that they might get better care there. And the quote I have on the slide, I felt like expressed the sentiment really eloquently. This person said, we have a local hospital we call the Band-Aid station because they don't have very many resources or up-to-date medical equipment. It's one of those communities where you go to right after medical school to get some of your student loans forgiven. So there's high turnover and low quality. People will drive an hour in an emergency to avoid that hospital, even though it's there. People also said that another reason that rural residents might be deterred from seeking local care is due to stigma. So in particularly small communities, residents just are more likely to know providers at a local healthcare facility. They also might be more likely to know the people they come across in a waiting room. And so especially for issues that people might want to keep private, like a chronic condition or a mental health condition, people might choose to avoid those local facilities because maybe they're uncomfortable getting care from someone they know for that issue, or maybe that they fear information could be spread. So again, this quote I thought demonstrated this really nicely. This practitioner told us, stigma is such a big barrier. People will travel out of our counties to get mental health or any kind of physical health treatment because they don't want to be stigmatized because, their cousin works at the hospital or so-and-so will see them and they don't want people to know that they have an opioid use disorder or have been thinking of suicide or have a disability. Next slide. So these two big themes were connected to some additional consequences. So it kind of tells a story with the remaining three themes that we found. So first, because of that lack of local services and because of the reluctance to use those services that were present, participants told us that they saw residents needing to travel further and further to access care, especially those more unusual types of care like specialty care and mental health care. And in rural areas with very little public transportation options, this meant that people who didn't have a car were becoming increasingly dependent on others for rides. And that could be especially limiting for older adults or people who are socially isolated. Second, people told us that these challenges were also leading to growing costs associated with seeking care. So increased travel distances obviously come with higher gas costs, but if you're having to travel especially far, that's also going to require spending money on lodging in hotels or meals out. And having a far travel distance also means you're going to spend more time seeking care. And so we discussed how that time burden can impact, wages, both for the people who are seeking care themselves and for people who serve as caregivers and have to transport a loved one to get care. We discussed how this added cost burden was increasing disparities in healthcare access. So this would be especially burdensome for lower income rural residents. And then finally, we did have some really great conversations around telehealth and the possibilities that telehealth provides. So there was a sense that, people were excited that telehealth could help overcome some of these gaps in healthcare access. But we discussed that there were numerous barriers that remain towards making this really work. We discussed barriers related to access. So we discussed the lack of broadband or quality connection in some remote rural communities. We discussed barriers related to affordability due to the cost of internet, the cost of digital devices, and we talked about the barriers related to adoption. Maybe that's due to a lack of digital literacy, a lack of trust in technology, or a lack of trust just in the medical system in general. And we also talked about some people's preference for in-person care and how to navigate that. So there was this general sense that harnessing the benefits of telehealth would require structural change in communities and also education for individuals. I'll pass it over to Katherine.
Thanks, Christina. Hi, everyone. So I'll be sharing needs as stated by stakeholders who participated in the listening sessions that we've been talking about today. You, actually, as a participant in today's conversation, are also part of who we consider stakeholders. So I invite you to reflect on where your thoughts align with those that we're sharing here today. And as so part of what we're going to be doing, part of my pitch is actually to invite you to participate directly through a survey. So stay tuned for information on that in a couple of minutes. Among participants in the listening sessions, one of the most common stakeholder needs concerned how to share information and raise awareness about a range of topics. Some struggled to know how to raise awareness around chronic diseases and promoting positive health behaviors. They also stressed the need to ensure that residents knew about area resources in a timely manner before it was too late to be of any use. Limited internet access and transportation options, coupled with the decline of local newspapers, made timely delivery of relevant information a significant challenge for several of the respondents that we engaged with. Stakeholders also expressed an interest in wanting researchers to draw on local knowledge and to draw on local voices to inform their research and to provide context for their research, and ultimately to make research most impactful. So, for example, one stakeholder said, and we've got it here on the screen, researchers should provide context with the results of their research on population change. What does it mean for different states and different parts of states? And then work really closely with extension professionals to communicate that effectively to rural communities and make it useful to them. So again, that need to engage with that local knowledge and local context. Relatedly, stakeholders we listened to wanted data. They wanted research findings, they wanted best practices, and better evaluation tools to improve their own programs and to better inform their local leaders and their community members. For example, one stakeholder said, and I really like this quote, "Just give me some tools, give me the data, give me the tools where I can pull the mayors and the county commissioners aside and say, look, here's what the research is saying is going to happen. Here's the reality. This is what happened over in Kentucky. This is what happened in Mississippi. So that's the kind of stuff that I need as far as a stakeholder like myself to disseminate your findings. So just send it to me, I'll use it." And again, I really, really like this quote because it embodies the excitement and eagerness that many stakeholders, such as yourself, had for obtaining accessible research findings that could be easily translated into their own communities. So, since these listening sessions, which were again about a year ago, we've been disseminating findings through a report and presentations just like this one. And you can navigate to that full report through this QR code on the screen. I'm going to pause so you have a chance to do it. We really do hope that you engage with it. Next slide, John. Thanks. We've also solicited from listening session participants resources and programs they have actually found useful in their own practices so that we can compile this information and share it with stakeholders, ideally including you. The aim of this effort is to offer a resource guide to enhance stakeholder efforts. And so collection of these resources is currently underway, and we would love to include your input. So folks who are on the call today, this QR code, we've got a lot of QR codes for you today. And this is one of them that's important as well. This QR code will take you to a survey where you can share programs and resources that you in particular have found useful in your own work, in your own communities, in your own program areas. So I invite you to contribute to this effort. And ultimately, our team will be sharing with you the resulting resource guide that comes from this. Next slide, John. Thanks. So on behalf of our team, we're very, very grateful to you all for spending your time with us today and for the work that you're doing in your communities. And at this point, I think we're going to open it up to your questions and comments because if it wasn't clear to you before, I'll make it really clear to you right now. We're very, very eager to hear from you. Thanks.
Great, thank you all. If you have any questions or comments, please put them in the chat and I'll be happy to read them off and point the team to the question. I see that they've put the links to the survey and then put the links to the report as well in the chat. Well, I guess I'll start off with a comment. Sometimes people just need to break the ice. Certainly, this is very similar in terms of topics that came up when the RRDCs actually did the listening sessions around the country, particularly around healthcare, I'll call it workforce development, housing, caregiving, things that were obstacles to some of those things. So it's, I guess it's interesting to see, not that things were going to change in 3 years, that it's the same themes we see over and over, that are these big problems that are structural problems that need to be kind of thought through in a holistic way.
I'll comment on that briefly, Maria. In terms of, going back to the connection between these two projects. So as you mentioned, the similarity between the RRDC's listening sessions that were done. I guess we started that project in 2021. It seems so long ago, and shared that information with the Rural Population Research Network. And then the idea was, let's explore these topics, although we didn't specifically, just say these topics. So they were able to come up through the conversations, but let's use this method and hone in on what are the research needs, so that the work of extension professionals and other folks working on the front lines could help drive the research, and hopefully make projects and make the output and dissemination of that more useful. So I think that's very exciting to see the one project folding into another and informing another, so that we're not just doing these as one-offs, but we're building a broader knowledge.
We do have a question now in the chat from Jacob. Let's see. So, I was going to. What I find interesting about this is that regardless of regional differences, many of our rural communities across the states are experiencing similar challenges. What would you propose in efforts to reduce the impact of these challenges?
I can get us started. So our findings are such a laundry list, right? It's kind of overwhelming of all the challenges across these areas. I think one of the things that we like to highlight that comes out of this is exactly what you said, Jacob, which is like, first of all, these areas that are looking very different demographically are still facing many of the same challenges. So it's important to first acknowledge, okay, there could be solutions that we implement that address a similar problem in very different areas. And so it's important to recognize our common challenges, to kind of have that coalition building and be thinking about next steps. And then how I take this too is like kind of piecing out the chunks and thinking about how each of these many themes that we talked about can inform next steps, right? It's kind of overwhelming to me to think about everything at once, but to focus on one specific theme and think about how that can drive the research that we're doing, or if we can be helping to think about how to find a solution to this. So I can give an example that I've been thinking about a lot recently. As I mentioned in my section, we had a lot of great conversations around telehealth and the possibilities that telehealth can do for addressing these really big transportation barriers we talked about. In other work that I'm currently doing, I'm mostly a substance use researcher. I've been talking with many rural providers recently, and there is this big move post-COVID away from telehealth again, right? So it's like we started to create this telehealth infrastructure, and now that COVID's in our rearview mirror, we're just going back to what we were, instead of thinking about how these structures we created can help us get around these transportation barriers. So like seeing this in my research, while also recognizing it was such a big topic we talked about in the listening session, I'm thinking about how I can use research to think about designing an intervention that can try to get that provider input back in, to get those providers to buy back into telehealth and make it more of a integral part of what they're doing to serve people in rural places. So that's how I'm thinking about how do I use something that came out of this listening session to drive research that I'm doing that will hopefully take one small step to show how this can be done.
Just to build off that, I think broadly we've had, as a group of like the rural Population Research Network coming out of this. I know we're demographers. And so I think we kind of had this reflective moment of like, we also need to start studying solutions. And so I think that was just a really poignant point of like, you know, I'm a sociologist, so I'm like, I love pointing out problems and pointing to like structural issues. But like, how can I use the tools of social science? And I think Christina's example is poignant for that, of how can we use the tools of social science to also study the solutions to these things. So one of the things that has stuck with me from the listening session was around projects in Iowa around smart shrinkage. And so I've been working with a team to try to start thinking nationally of like, how could we study rural places that are experiencing population decline, but have been able to maintain quality of life. And so trying to do that nationally to look for examples, and then, you know, doing some case study work to be like, how have they actually been able to do that? So first using the tools of demography to find places that have actually done that, and then digging into like the process to see if there are ways that we could be directive in terms of supporting communities or like offering models of that. And so I think that's been one of the generative points around here, is like just shifting our framing to of like, look for solutions, not just the problems. And which I know is the good work that Extension is always doing. But yeah, definitely for me is more of like a primary researcher in my field. That's been kind of a shift for me as well.
From a natural resource and environment standpoint, you know, pollution was one of the main concerns. What we're doing in Tennessee is through a US EPA project that was funded. We're looking at technical, managerial, and financial assistance to drinking water and wastewater system operators. We're basically helping them identify the assets, do an asset management exercise, and looking at financial sufficiency. How can we, you know, pay or charge enough for the true cost of water so we can mitigate pollution. So that's one way we're looking at it.
Something we're all very chatty now. It just took us a little while to get warmed up here. One of the things that I wanted to emphasize in all of this is that there are these shared problems, and then the nuances, however, there is some variation. So I just want to again elevate that call from stakeholders to integrate the local knowledge and local voices, because I think that that's a big part of the solutions. And in fact, that's part of what's driving, at least, well, I think it's our group's interest in what has been working for folks in different areas to get a sense of this variation. So again, there is a lot of shared experience and commonalities. And then there's also these kind of place-specific or community-specific variants that make a one-size-fit-all response really impractical.
I think there's a question around from Julie. Did you collect demographics of the survey and listening session participants? Do you think these local voices were well represented in these findings?
I'll start us off again. So I will say that we did not collect demographics, and that I do not think that this is necessarily a representative sample, right, of local voices either. And the other important piece to point out, I sing this all the time. I always say, you know, you can't approach community stakeholders and think that they're speaking for the whole community, right? So we're really like careful to say that these, you know, these are practitioners, right? So these are people that serve communities, and they're speaking about their observations, but they're not necessarily speaking about lived experience. And so we're trying to like frame this as kind of like a call, for example, to rural demographers to say, hey, here are some things that people are seeing. Let's start to dive down deeper into these. And hopefully at that stage, people will create, for example, more rigorous research designs that are then going to get deeper and broader samples. So hopefully, like, we're speaking to people and they can start to see these things that these practitioners think are important, and then they can drill down further. So it's kind of like a call to action in some ways.
But also most of the problems we identified are pretty common, and you know, most of these things are universal in terms of, you know, what's going on in those communities too. So I'm sure every state has similar issues that we talked about, and that is what we're trying to portray here.
I think that's a perfect inroads into the next thing from Emily Smith, where she says, in Kentucky, our rural populations and urban pops experience the same challenges: limited access to resources, challenges with transportation, health provider shortages. So she would also like to hear more about mitigating these challenges. I know we focus a lot on rural, but there are very similar populations. So I know, Kristen, you had unmuted. Katherine, you'd unmuted, so you can probably continue with that thought.
Well, I had a different thought and I saw Paige on mute, and so I'd like to hand it over to her. One of the things I was going to say, though, in regard to the previous question is, as you'll find in the report, if you haven't already, because I'm sure you all raced to the report and started to read it, is something that we're really excited about was, in fact, the geographic coverage across states and across regions. And so, again, just really want to stress what Christina said. These are not necessarily the local voices. These are practitioners who are working in communities. But one of the advantages, I think, of this effort was that geographic representation, so that we can have some confidence in the statement that these are kind of shared problems across contexts. How precisely they play out and how precisely we respond, that's where there's variation. And I'll turn it to Paige, who's going to respond to the urban rural.
Love urban rural. No, I think that's a really good point. I mean, we see in a lot of like small cities experiencing population decline in the same way. And so I think in the same way that we can learn things from, rural places that are doing it well, we could learn well and like also not treat. I mean, I think as rural sociologists, like we don't like to think about rurality as like binary, like it's this continuum. And I think one of the things that was interesting from the report too, we use this framework of declining and growing rural places. And, the ironic thing about like successful rural places that grow too much is they become urban. And so it's like, at some point, these places could actually be recategorized or reclassified as metropolitan. And then they just get kind of lost in that in terms of like our demography eye of like what rural places are experiencing. And so in some of our analysis, we've started to try to think about like how actually we really need to think about like the, kind of spatial structural processes that led to, the kind of moment of lack of infrastructure, lack of services, that kind of shared history, and that's shared across places, that then, leaves them kind of at a deficit to provide these resources and respond, whether it's to population decline or population growth. They're kind of at this kind of, they have this shared history of kind of having limited economic and institutional resources to respond. And that's not, that's shared across rural and urban places.
There's another question from Tom. Says, I'm picking up a lot of concern about the quality of rural housing. Did you pick up feedback affirming this perspective?
Yeah, sorry, I'll always just kick us off. I'm like, I have thoughts. So yes, this was definitely something that came up. I'm so glad that you highlighted this as an issue. We are actually working on another publication from this data, and we ended up shifting, and we're not focused on like our 4 listening sessions as buckets, and we elevated housing as its own important theme, right? So we kind of took it out of community and economic development, so it wasn't hidden in there, and we said this rose as such a big thing, we want to highlight it. So again, we talked quite a bit about kind of like how housing shortages as an issue that people were seeing in growing and declining communities, but in growing communities, it was really coming across as lack of affordable housing, and declining community is really coming across as lack of quality housing. And the other thing I found interesting is that our discussions led us to tying this well into other themes as well. Something that I personally hadn't ever thought of in connection to quality housing was the aging in place trend, right? So one very interesting thing that we had discussions about was that when we have folks who are remaining in their communities, that are living at home for longer periods of time, there's shortages in, for example, senior living facilities. So maybe folks who are aging are not moving out, right? They're staying in their own home. And so that is leading to like some deteriorating housing quality, as people can't necessarily upkeep their homes themselves or don't have the income to be be able to pay for repairs. And so that aging in place trend is kind of contributing in part to a decline in quality housing. So I thought people did a really nice job of connecting the dots too, of showing how this housing issue was connected to the lack of healthcare facilities, was connected to the demographic trends we see with aging communities.
One of the project I'm working on that is connected to housing was rural gentrification. We're seeing like gentrification not only like urban areas, but also in rural areas. And we're actually looking at how to measure that using specific indices. And then we're presenting that hopefully at the Rural Sociological Society meetings in July.
Okay. Well, I just want you to know that Tom said he wrote a book called Pulling Together, focused on rural leadership and development. So look for that book. There's a question from Kitty or a comment. In the work I've done with food access in rural areas, we found that there are a lot of people who fall into the ALICE population or ALICE population, and therefore are unable to get benefits, but also don't have enough to live well in the current economy. Does anybody want to talk a little bit more about food access? As I know somebody did that. I can't remember who was that talked about that at the beginning.
You can go for it, Catherine. No one goes. No, I mean, I think generally, I think this was a theme that came up just around, and again, that there was kind of divergence in food accessibility. Just that, I mean, I think in rural areas that we saw that people noted having to, transportation costs around food to drive to grocery stores if they didn't have one locally. And then oftentimes that those grocery stores had higher prices, so they were paying more for the same product. And that obviously then compounds if you have benefits or not in terms of how far you can stretch your money. And so, yeah, I mean, affordability is a huge issue right now, I think, so.
I think Gwen also talking around housing, said the lack of public water and sewer assets prevent housing growth in rural areas.
Absolutely. We're hearing a lot of those things even in the state I'm in Tennessee. We have lots of issues with water quality aspects. And along I-24 corridor between Nashville to Chattanooga, we see a lot of tiny homes coming up. These are like maybe 500 square feet homes, but they're all bunched up and clustered in some locations. They don't have as specific sewer connections, and the water quality is poor, and it's getting dumped along the river all along. So we see a lot of those things. But again, going back to federal state standards and try to comply with those will help us. And we're trying to work with water system operators as much as we can.
One thing that comes to mind in this conversation, as well as in others, is that even as we've presented the results according to different organizational themes, right? And for me, I think about them as programming areas with an extension. But as on full display right now is how each of these issues is actually, it's intersecting across program areas. So as I'm preaching to the choir here, but it's not one program area. Housing isn't just housing, it's housing and environment. Food isn't just food, it's food and community development and health. And so we're just seeing how these different issues that are confronting most everywhere, growing or declining in population, it's a cross-program area issue.
There's a question from Brandon, and I missed one, but I'll go back to it. I'm curious to hear if rural communities wanted to grow but didn't want new people. That's what I'm hearing all over Arkansas. We want our town to grow, but we don't want to do it from the outside. We want to do it from people here. That's scary. That is a scary thought process to me, but I feel it's a driving force of why many communities are stuck.
I think one theme that came up was around there was kind of there's rural urban tension, and also newcomer, oldcomer, I think was one of the codes that came up. I mean, that's always, unfortunately has always been a dynamic of, and then I think, in rural areas, depending on where you are, if it's You know, we know that rural areas are becoming like new immigrant destinations as well. And so that can place strains on, you know, the local like in terms of social services and supports for those populations. Sometimes that can lead to concern around that. But I don't know if there was other things that stuck out to, I'm like,
Yeah, I can jump in on this one a little bit. When I hear this comment, I actually think about it from the frame of place attachment. And so what comes to my mind is, what is it? What is it about this place that, you know, someone expressing this concern is really talking about? What is it about their community that they don't want lost through some change, knowing that communities inevitably change. There is no place that has ever remained static. From a demographic perspective, I think, or from really a social perspective, time has a way of moving things along. And so here I think about it in terms of identifying what is the important asset in the community that this group or this person or that person is really invested in and wants to see preserved or otherwise nurtured along with whatever change is happening around them.
To me, it's a question of critical mass, or do we have enough people to support services and things going on in the rural areas? You know, is that happening, and can we support enough tax revenue so that we can actually see change? If that is happening, absolutely. If we cannot, we can actually seek some help. And you know, I've seen in communities where, oh, if it's a grant, we'll take it, but if we come up with a match, oh no, no, thank you. So I see that often quite a bit. But we have ways to work around it, but those are the challenges we face. That's the reality.
Okay, we have time for one more question. I see, Rick, you raised your hand, so I will unmute you for your for the last question.
Well, thank you. Thank you. So I'm going back to Katherine's question about what is it about a community that is important? And I pose the idea that it is the individual person that's expressing that concern, that wants to stay in their community. They want to live and thrive and be healthy and raise their kids and send them to school, etc. You know, with good meals under the from their table, etc. And that they feel threatened and they feel disempowered and trapped. They don't want to, you know, in my case, Katherine, they don't want to move to Madison. They want to stay there and make their community there better for themselves and for everybody else. And they're not finding the resources to do that personally and otherwise. And so that's not a big clue. That's been forever. And so we just got to keep moving on and putting our nose to the grindstone and making sure that rural communities, you know, and in this day and age, it's a big ask, but get the resources pointed in their direction so that we can bring all of the aspects of extension, etc., to bear for the benefit of those that we're talking about. So that's my take, and I'm glad to see that there's so many people on this call that that care about it too. So thank you.
Yeah, thank you, Rick. I appreciate that. I think that you're speaking to a really important, salient piece of what's happening and has been happening in rural America. And to bring it back to something that we kicked off here, whether the rural community is confronting decline in population or whether it's confronting growth in population, you know, these questions around community and how I fit into it and how I can get my housing needs, health needs, educational needs, occupational needs met, that these are all persistent across rural communities. And so I appreciate you bringing this point up, because people are heavily invested in their communities. And so I think it is a matter of reflecting on, yeah, what is it about the community? What does this community need? Because regardless of whether it is a growth or a decline scenario, change is afoot.
Great. Thank you all. This has been a wonderful webinar with great discussion. And I will do a plug that pretty soon, before the semester is over, there will be the RRDCs got together and we surveyed. I mean, a lot of these questions about placemaking, housing, caregiving are in that survey, and we'll make the data open. We always do make the data open access. So for those of you that want to research with more data, that will be available pretty soon to you. Open access at no cost. So I'll make a plug for that for later on in the semester. But thank you again, Sridhar, Paige, Christina, Katherine, and John for a wonderful webinar and such great discussion. And thank you all for joining us. And we look forward to seeing you at our next webinar, March 25th at 2 p.m.